What could it look like when brain health and spirituality are authentically integrated into medical and academic paradigms?
What is in that is causing all these neurological and psychological actions without physical touch?
Welcome to the Frequency Files. Thanks for joining us as we explore the vibrations, forms, and creations and mechanisms behind them that inform the nature of existence. Today we have the joy of speaking with Dr. Teguo Djoyum, a neurodiagnostics expert, public health practitioner, and a researcher who focuses on brain health, spirituality, and epilepsy care in low-resource settings. He graduated from Harvard Chan School of Public Health University, where he worked to examine the role of cultural and spiritual factors in healthcare delivery. Dr. Djoyum has led international health initiatives in Africa and has collaborated with policymakers and community leaders to improve access to care for people with epilepsy. And Teguo is dedicated to really fostering culturally sensitive approaches to healthcare delivery and to advancing healthcare equity globally. Teguo, it's amazing to speak with you further about the depth and breadth of your work. So thank you so much for joining me today.
Thank you, Sarah. It's a pleasure for me and that we finally made it. We've planned this few times and this is the time we are together. I'm really happy to be here and happy for your listeners who I think share the same curiosity as me about spirituality, health, and brain health and whatnot.
Yeah, absolutely. You've got such an interesting background, and I'm really curious what it is that led you to the point that you're at now.
Wow. Very interesting question. Well, I'll start from I was born in the little village in Cameroon, Central West Africa, in a little village in Banjul, the western province of Cameroon, where I did my most of my studies all the way to college. But I grew up with a sibling who had epilepsy growing up, so that led me to live very closely the stigma, the discrimination faced by people with conditions that are not visible or that are not easily explainable, like epilepsy or other neurological conditions that are not visible. When you break your leg or break your hand, people can see it and know what to do. But conditions that are not visible are usually associated with stigma, especially in places of low resource, low setting. So that haunted me to understand more about it. And when I moved to the US back in I would say 2008, 2009, something like that, I did um, try to understand and pursue my education, starting as understanding about epilepsy. I work as a EEG technologist, very entry level into the diagnostic of people with epilepsy, and moved up to do neurophysiology, which is assisting surgeon in surgery to take care of people who qualify for surgery. Then from there, I, started a nonprofit with some friends and called Gohi back in 2015. So it's like almost 10 years now. And, the idea was just to go back to where I started, showing people that, well, I've actually went and learned about epilepsy. It's not a curse. It's not contagious. And people who have it just need help. They need, empathy and medication and support. And then the nonprofit we started allowed us to travel around the world to talk to people about the resources, explain to them that epilepsy is not contagious. It's a condition that is well diagnosed, and with medication and support, you can actually get care. But when I travel in many places, there was a question that kept coming. Is epilepsy spiritual? And there's a book I read called "The Spirit Hit You and You Fall Down" by Anne, forgot the last name, of a story of a family in Verset, California, a monk family that immigrated to the U.S. and in their belief back where they came from, uh, epilepsy is a spiritual condition that has to be dealt with using what they call the yin yin, and the shaman has the specific role they play. And it was this battle between this family and the healthcare system of not understanding their cultural beliefs of the condition and the fine middle, like what was the role they could play and the role the clinical part could play for us to achieve that holistic care, but in collaboration with the beliefs of the people. And, I read that book to understand a little bit more about the questions, and it led me to actually dig deeper to doing a dissertation on spirituality and brain health case of epilepsy in Ghana, where I work with traditional healers, pastors, and imams to understand what are the barrier and opportunity of collaboration between spiritual leaders that I put as a whole group and traditional and clinician in the care of people living with epilepsy. So, and yeah, that's me. And outside of that, I'm an entrepreneur. I like to do innovation in epilepsy. I've done some entrepreneur work with Purple Point Neurodiagnostic, where we actually, in some places, help them provide diagnostic services and improving services, capacity building in low resource setting in America and hopefully soon in Australia. We provide capacity building for clinics that are intending to include epilepsy services into their practice. We come in and assess what they have, look at the opportunities and assess the workforce needed, and prepare them to actually embark on this new service with support of remote expertise while they build local expertise. So that's in a nutshell me.
That's amazing, amazing. You're a very busy man. I've got to say, as someone who's gone through the journey, it is beyond refreshing to see someone really taking that brain health, spirituality, spiritual dimension of the seizure phenomena seriously and exploring it at great depth, because I can say in my personal experience, I found many overlaps with many people that I've spoken to across the world. So I'm very curious to know more about what you discovered when you really embarked on that quest, and how those different parties interacted or do interact or can interact, or what is possible there.
Wow, that's a big question. And that question still, you know, the so my research was an independent funded research, and with the support of some very generous labs at Harvard, I had two small fellowships that allow me to scratch the surface. More work need to be done to understand in depth of what people actually um, believe at a larger scale. I had interaction with over, I think, 65 people in my the group I interviewed, because I did mostly a qualitative work, which was a lot of interviews, workshops, and questionnaire and interaction with people. There was another piece of it that was qualitative, where I did just a survey of thoughts and beliefs of what people, general impression of if they have even know if they think epilepsy is spiritual or not. And the findings are very interesting, and it's from both sides, both from the clinician and the spiritual leaders. Most spiritual leaders believe it is spiritual, especially those with lesser education. Those that are more educated kind of like, no, yes, this is not spiritual. And some clinician are still questioning if it is actually, clinical or just something that you have, or it is also spiritual. And in some of the conversation, there's some clinician who actually said, well, there's some cases that they're not able to treat and that they believe it's something else. The person is still having seizures. they're giving all kinds of medication. But science kind of explains that, right? Refractory seizures. There are some people that are their type, the specific type of their seizures foci or where it's coming from is resistant to the type of medication they're given or the type of medication available in this context. So all this kind of so there's a mix of lack of resources leading to belief of what we don't know is spiritual. So that layer makes it very easy for people to embark on that. But we don't need to forget that even in America or in the ancient books of still when the medical books were inscribed on rocks, uh, I mean, epilepsy in some of these scripts were described as the wish, the bad wish, right? Because it was described as the bad witch. I forgot the exact books were, but in it, like in the hundreds, they thought it was a spiritual attack on people. This is in science books in the past. So it took time for that narrative to change. And in some part of the world, it's still taking time for more of the people to understand, what is the association or dissociation to spirituality with that. But that doesn't mean spirituality don't have an impact on health or spirituality don't have an impact or an importance or play a role in caring for people with conditions like epilepsy.
What kind of role can it have or does it have in your opinion?
So in my work, one thing I found was the way I mean the data shows that a good number of people in Africa is not limited to epilepsy. They seek care to spiritual leaders or traditional healers more uh, easily, not because they don't just because they're more available, right? The
Yeah.
proximity of a person in a rural part of Africa to a hospital who is closest to him is a traditional healer or a spiritual leader. It's closest to him than the next hospital or the next clinic. And these people have served as trusted people that they go to for support, prayer, uh, moral, spiritual support for conditions they have that are very complex. So they play a role in search for support, moral support. They play a role in finding alternatives when clinical services is far away, or when clinical services is short to provide solutions, again, in cases like refractory epilepsies or epilepsies that cannot be easily handled by medication, and there's a good percentage of people who have those type of epilepsies that are not treated by just the medications that are available. And we're talking of anti-epileptic medications that are very expensive and very hard to get. And we're talking low resource setting. So you are in a country where you have access to five, and that's all. That's the only five you have access to. So, and in here we're talking of like, 50s and six, like there's so many kinds of those medication in the West or in Australia, US. So in places where those are limited, again, for those who would be resistant to it, it increases, right? Because there's not many. And it's easy for them to find support from spiritual leaders and traditional healers that are very available. And my work was basically trying to ask the question, what are the opportunities and barrier of collaboration with this group of people who are already in contact in a very close proximity with this patient or these people living with the condition of epilepsy and other neurological conditions.
Mm, mm. Yeah, it really highlights the contrast of those different contexts. I'm very curious what some of the maybe unexpected findings were that came from that.
One of the unexpected findings I have is the fact that clinicians are less open to collaboration. And, I know this is not, I'm from a clinician myself. It's hard for me to believe that. But clinicians are a little bit more resistant to collaborating with spiritual leaders. That was very, surprising for me that, the person to do the first step, uh, like the imam, the traditional healer, the pastors, they're like, yeah, we want to collaborate. How can we collaborate? Like, we want to engage. But the clinician were asking me questions because I asked them, what will collaboration look like? They're like, well, we really have some issues with them because some of them are not trained like we are trained. And some of them don't have the same values. People complain about, I mean, most of the published data that you see out there about traditional healers or spiritual leaders is the negative part of people who went to spiritual spaces and the people were, let's say, maltreated because let's say they're doing a practice where they say we're going to cast the demon out of you, and it leads to physical violence because they're doing a practice to kind of cast out that spirit from your body, and it become violent and whatnot. So that's more what most clinicians want to associate the spiritual leaders to. Whereas you have spiritual leaders who their role is basically that spiritual support, like just the prayer that some people receive from the spiritual leaders give them hope. And I mean, science proves, and the 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 avenue or the arrival of meditation in the world, people discover like, wow, that is the benefits of meditation people are using now in therapy. And so that process of praying for someone or singing for someone or chanting relaxes nerves and relaxes the body, aligns your body, and that alignment and that calming of your body can actually go to the point of calming your brain if you can understand how to rhyme in different frequencies. And this goes to you always talk about frequency, and this get to that segue of, do clinicians actually understand frequency? Do they understand that frequency is what we are? We are frequency. Like, and in brain health, when we do an EEG, the principle of an analysis of an EEG is based on frequency and amplitude. What is the frequency of the occurrence of that brain wave? It's waves of different frequency, different amplitudes, right? That's the description of EEG. What is the frequency? What is the amplitude? Like, how often is that beep happening, right? And how big is that beep? What's the frequency, amplitude, right? And if I do this, right, you're following with me. Your eyes are beeping faster. And if I keep doing it not and too much and too much, I'm irritating you from here. And that irritation is a wave frequency I'm sending from here to you. And it's physically reaching you. Like, as you listen to me in this podcast, imagine me speaking fast and sending you very fast beta frequency. Like, I'm talking to you very fast, sending you beta frequency. You feel it, right? Let me bring you back and calm you down. I want to calm you down with a delta frequency wave. I want to speak gently to you, and I'm giving you hope. I want you to feel in your body that this epilepsy that you have is going to go well. And I want you to believe that this medication that you're taking is going to help you. That is the spiritual work that the spiritual leaders bring into health, and that I see valuable and physically meaningful, and that people can feel just listening to this little blip of this podcast. will not need to do research for it. It is here.
Mm, 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 mm. Very interesting. And I'm very curious what kind of possibilities you see moving into the future in terms of how we can forge or reimagine deeper collaboration or communities of care.
So, I mean, I know what I'm saying here. A lot of researchers in this brain health space will come and chase me and, probably beat me up or whatever. But there is no future for brain health without the implication or the understanding of spirituality and understanding of frequencies. Those two things, we can get all the medication we want. We can put all the science we want to do. If we don't include spirituality and frequency, understanding of energy, frequency, and spirituality in brain health, we are doing work, we are helping out, we're working, but we're missing a piece of where health started that we're skipping. And we are bound, and I mean what I say. Maybe in 100 years, this will make sense. We are bound to go back to where health is a wholeness. Health is wholeness. And I speak for brain health. Brain health is in the inclusion of spirituality, the inclusion of frequencies, understanding that frequencies can alter, not that can. Frequencies actually alter your state, right? When you close your eyes and you're awake and relaxed, if you do an EEG on your brain, it shows a specific stamp of frequency. That is the state that in which you are. It's a frequency stamp. When you fall asleep, we know that because when we look at your brain waves, you fall in a specific frequency. Now, there are people who have practices like meditation that allows you to put yourself in a specific frequency without just being in that frequency on your own, but you can actually bring that frequency. Music therapy, for example,
Yeah.
something people don't understand or don't know, but I understand music therapy because I understand frequency, I understand waveforms, and I understand what that music tune in the right frequency, what it can lead to, positive or negative. Some music make people violent and aggressive. Some music make people relax, calm, happy. Some music make people cry. Some music make people smile. What is in that? What is in that that is causing all these neurological and psychological actions without physical touch?
Yep.
And if understood well, can be utilized in
Yeah.
different ways.
Absolutely. I've just interviewed Barbara Minton, and she's a psychologist and has a neuroscience and music background as well. And she's phenomenal at explaining how all of these things synergistically work and what's possible when they're approached with consideration in therapeutic cases and in well-being cases, right? For any of us. Absolutely. Yeah, so much that is available and that people are already using in different ways. It seems like there's a bit of a slow going in getting quote unquote higher institutions to really come to the party with this, because there might be a lot of undoing of previously held belief systems or connotations or orientations of reality.
Yeah. I mean, I think there's a physicist that I work with who usually say, the crowd wins. The crowd wins, and you would say the things that we will maybe want the people to believe or people to listen to or put systems and processes in place for people to believe only in certain things, but the crowd wins. What I mean the crowd wins is the more people would see value in spirituality for their health, and people are seeing that value. Again, I am not here to replace healthcare. I don't advocate for people to replace healthcare. And I said it in my final thesis, which is published today in the ResearchGate. It's available online for those who want to read it. I suggested three key areas of collaboration. The first one I put in is about just creating spiritual spaces in hospitals. It's already very available in the United States and Australia and other countries. But sadly, in Africa, widely, the integration of the chaplaincy service is not as widespread in public institutions. Faith-based hospitals, let's say, a Catholic hospital, a Baptist hospital, an Islamic hospital, or Buddhist hospital in Africa, it is a Christian hospital, right? It's a faith. When you come in, it is part of their practice. They don't restrictive of what you believe. They do their practice of what they believe in providing you care. But I recommend that in government spaces, there should be a space for spiritual support, which is agnostic of religion, which is non denominational, a space where all spiritual beliefs can come there and support their patient or their member when they are at the hospital, because those two work best together, and we need to understand how to make that work together. So that's one of the recommendation. The second recommendation I made in my work from my findings was what I call the 360 referral loop. Because in the past, there have been work with spiritual leaders, traditional healers, and uh, imams on work with HIV, where they were encouraged to send family members to come get tested. And it was working well because there's a trust that the community have with faith-based people. And leveraging on that trust, it was easy to refer people to come to the hospital. But with time, that reverse trust is losing its power, and power dynamic is causing less collaboration. Because if I'm a traditional healer, if I'm an imam, if I'm a pastor, you are a clinician, I refer a patient to you who usually, when came to me, brought a present, and that I live on that present. And I don't see them anymore because when they went to you, they left and they don't come to me anymore. I lost my connection to that community and I feel like I lose some power. But the 360 referral here is basically a mechanism where, and I actually wanted to develop it as an app where you refer to me and I do the same back. So I, the spiritual leader, have someone who came and say, "Oh, my head hurt." And I say, "No, go and see Dr. Sarah." And you go to Dr. Sarah, "Oh, yeah, this is what you need. This is some medication. Let's say we do an EEG or we do an MRI, whatever, and this is your medication." And I tell the client, go back and see Dr. Teguo to let him know what happened. When they come back to the spiritual leader, the traditional healer, he blesses the medication and serve as the reminder for him to take the medication. That is a collaboration for trust and loop that we build. And the patient is not missed in the middle anymore. The patient have that support, both spiritual and physical, that is needed.
That's very interesting. That's
And I'll
very
let the third one for people to go and actually read the whole work, and then they can pull out the third
yes.
recommendation from reading it.
Okay. Okay. It's interesting thinking about that 360 referral loop. What happens though when they have moral or ethical conflicts with what has been suggested by either party?
So again, so that's where the work starts. for that relationship of the development of the 360 cycle
Mm,
need to be groundwork for you to be part of this system of referral of spiritual leaders and doctors, where some trainings that I'm trying to curate and build, those trainings will be provided to the providers in this system, because that system will be governed basically by an agreed upon way of care
yeah,
that they
okay.
all live in and go by. And that goes by their country. Let's say in Ghana, the Ghana Health Services or the Ministry of Health or the Ministry of Spiritual Health will work with the clinician and do workshops to develop this agreed care framework for epilepsy, agreed care framework for uh, psychiatry, a grief care framework for this. Then it's within that framework that the collaboration start. So it's
Okay.
rarely going to be a very far disagreement of I do this way, you do that way. We have a governing way of doing things that is agreed upon by our country, agreed upon by our license as a spiritual traditional healer, agreed upon by my license as a doctor, and that this is how we collaborate.
Interesting. And what I see the like the role that that would play in making things a lot smoother. I'm curious where things like intuition, particular or gut feeling, comes in. If we're going to say that we'll honor things like spirituality and people get a genuine feeling of like, okay, they've suggested you XYZ, this really feels off to me, and I always trust my gut, but I've agreed to this framework. What happens in cases like that?
I think in more research we'll find out what it works. It's hard for me to I've not faced it. It will be hard for me to make a prescription or
Yeah,
recommendation based on that. But it would be interesting to for further work, because again, my research work is just I can't even call it research work. My exploration of this lens of health, a lot more need to be done. Years of understanding of this spirituality and brain health and epilepsy needs to be done to come out with more rich and rigorous frameworks and pathway to care for the clients or patient. My work was just to open the door to
it's great.
this angle of care that we
Yeah,
need to explore.
absolutely. Well, it's fantastic, and someone needs to open the door. So go Tigo for doing that, right?
Oh,
Amazing. It's amazing. And of course, it's going to be an ongoing exploration. And I'm curious also about the dimension of the patient's agency and what resonates for them if we're talking frequency and resonance. So them as that third party, the care is being built around.
yeah.
Mm,
And that would be a good angle for a next PhD or a next DRPH thesis on like using all my work and look at the angle of the patient, because I did the angle of the provider
yeah.
from the clinician and the spiritual leaders simply because I didn't have money and time to do IRB for all the patient and actually mobilize resources to reach more patient and do that. But it would be a very good research and a very implementable research, because it's not just researching to understand, but it's researching to actually care for people. It's not just to learn people like guinea pigs, but it's really providing service while we are learning how service is provided.
Yeah. 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 Tigo, what's something that you wish people knew when it comes to brain health and spirituality?
I mean, I wish a lot of people knew just even about frequency for themselves, like for your wellness. When you're stressed, there are ways you can actually by yourself find ways to take care of yourself personally by just resources that are available. I'm not telling people to self-medicate. I'm just telling people to practice awareness activities that help them and help their brain to be healthy and to be more productive.
Mm. Yeah, absolutely. Before we wrap up today, Tigo, is there any final words you would like to share or thoughts?
Yeah, so one thing I usually like to share when I have the opportunity to talk to audience is most of the work that are done that resonate with people usually don't get far because they don't have the resources to push their work further. I mean, with you in your podcast, I mean, if you had unlimited resources, you can put this to the hands of more people. With some of the research that we've done, with the resources, we can put it to many people. So I usually like to invite people to find things that mean for them. And even though they cannot be that person doing, they can be that enabler of the person helping the other doing to reach more people. Like more people should support your podcast for it to reach more people who need it, or to invite more guests, or whatever it could be to advance what is done. And similarly with the things we do, more people should get involved. We have a conference in Ghana on neurodiagnostic and epilepsy care in low resource setting. We invite people in Australia to, maybe if they don't want to come, they can come. We have a colleague from Australia, Dr. Simone Barry at Adelaide Hospital. Shout out to her. She's my very good friend. She's going to be coming to Ghana with us. So Australian, she's coming to Ghana to learn with us and see how we can mobilize resources to help people. So inviting more partners from Australia and around the world to learn what we're doing and translate that to the world.